Here's the question. Answer this. Now let's look at the organism specific features. The image that you are looking at is a rusty sputum and that is seen in pneumococcus. This rusty color of the sputum is because of old blood. And in children, you can see the spherical shaped or a circular homogeneous consolidation that is called as round pneumonia, and it is caused by pneumococcus. What you can observe in the image is a red currant jelly sputum. On the left side, you have the sputum, and on the right side, I have put the image of red currant jelly for easier understanding, and that is seen in Klebsiella. And on X-ray, you may appreciate the bulging fissure of the middle lobe that is called as the bulging fissure sign seen in pneumonia caused by Klebsiella pneumoniae. When we talk about the Staphylococcus aureus, the infection with Staph aureus usually follows influenza pneumonia, and the patient will usually produce a bloody sputum because of the necrotizing pneumonia. And the organism itself is very virulent and it actively invades the pleural cavity as well, and the patient will develop empyema and pneumothorax. Of course, you have also observed how the nematocysts develop in the case of necrotizing pneumonia. And in influenza, the patient usually will have upper respiratory tract symptoms predominantly in the initial phases, where the patient will have pharyngitis, rhinorrhea, nasal congestion, and the patient will also have high grade fever, severe myalgias, and fatigue. And the patient will eventually have a secondary bacterial pneumonia, possible because of Staph aureus. When you talk about Legionella, the patient will have a prominent GI and neurological features, and the patient will have anorexia, nausea, and vomiting. When you talk about Mycoplasma pneumoniae, the illness usually starts with pharyngitis, and on a radiological investigation, you can appreciate peribronchial pneumonia or bronchial wall thickening, and laboratory investigations will reveal hyponatremia and elevated transaminases and increased creatinine in these patients. If you find value in this video, please like, share to your friends, and subscribe to this channel.